It's very exciting finding out you're pregnant, and you're going to have lots of questions that you may want to ask. So firstly, we'd like to welcome you to the Hampstead Maternity Unit at the Royal Free Hospital. And in the following DVD, we'd like to show you what choices our service have to offer you and your family for your pregnancy, for the birth, and afterwards when you have the new addition to your family. If you're fit and healthy, having a baby at home may be the right decision for you. This option is safe for a first or subsequent birth and is worth considering. Why not have a discussion with your midwife? You can make a decision right up until the time you anticipate giving birth.
Another big factor is the fact that you're in your own home. You don't need to, at some point in the middle of the night, jump in the car and rush off to hospital all a bit panicked. You can set up your nest. And it's where you like to be. It's home. No rushing out.
How does it work out with the midwife?
She did what she would come in and occasionally want to monitor to make sure that Poppy here was okay and that she wasn't being distressed. But to be quite honest, both of them, Jean and Andy, both stayed in the lounge and just quietly chatting or having a cup of tea and just let us get on with it unless we asked them to specifically come in for something, but they would occasionally just pop in and make sure everything was okay.
If you're not keen to stay at home to have your baby, but want to keep your labour and birth as normal as possible, then try the birth centre. It's equipped with 3 rooms, run by midwives, and over 35% of women here use water for their labour and the birth.
This is one of our rooms.
Welcome to the birth centre. I've given you the leaflet to explain roughly what we offer and again our contact phone number. This is our birthing pool room. It's the largest of all of our rooms because of the pool. We've got the beanbag, bed, birthing ball, mat. We've also got aromatherapy stones on offer and CD player as well if you want to listen to music.
Do you supply the oils or do I bring my own?
We have a supply of some oils, but if you've got specific ones you want to use, we would encourage you to bring them in. We're also open for if you want to use homeopathy as well, but you must apply it and take it yourself. We've also got all the equipment in the cupboard that's hidden away, but it's easy to get to, not combined.
If I go in the pool, is my partner allowed in with me?
Yeah, of course, not a problem. Partners can go in. They're very supportive actually. It's not a problem by us at all.
Is there a limit to any other visitors or
birthing partners? Usually, the average is about 2. Obviously, any more than that, it becomes a bit crowded.
And how does the discharge work? If everything's straightforward and okay, am I able to go home in 6 hours?
Yeah, 6 hours is fine. As long as everything's straightforward and baby's feeding well and you're fine, it's not a problem. We can get a paediatrician to check the baby before you go home.
The labour ward is run by a team of midwives, obstetricians, anaesthetists and paediatricians. Women come to the labour ward if they're having a normal birth, if they need closer monitoring, or they anticipate having a caesarean section.
Well, sometimes some women just would like to see a doctor during their pregnancy, and if so, that's fine, and we try to accommodate that. But mostly it's if women develop problems during the pregnancy or have symptoms and aren't sure whether it is a problem or not, in which case either they refer themselves or the midwife sends them to see us, and we can give them a once over and reassure them or do any investigations necessary. Well, we see women, of course, in clinic, or if they get admitted to the antenatal ward, then we would see them then. Sometimes they come in with a problem unrelated to the pregnancy, and we go and see them on other wards just because, to check that their pregnancy is progressing normally and reassure them on that front. And of course, on the labour ward, even if they're not having a problem, we tend to do regular ward rounds and pop in and say hello and check everything's going okay.
Well, when you need to have a caesarean section, there will be a team of doctors on labour ward who will undergo the procedure for you with the help of the midwives and probably paediatrician and anaesthetists will all be there. We as consultants will be around. If it's complicated, we might do the procedure ourselves. However, if it's straightforward, we will be there just in case our help is needed.
We have 2 operating theatres on our labour ward. We can offer both emergency and booked caesarean sections where appropriate. The operating theatres are run by a team of midwives obstetricians, anaesthetists and a scrub nurse.
We encourage partners to be available to support you while you're having your baby. So therefore you're more at ease. You've got somebody who's familiar to be with you at that time.
Yeah, I'll stay with the lady, help and support her, because some of the ladies are very nervous, you know, when they come into this room. They will need a lot of reassurance. The doctor will be delivering the baby. So what I'll do is I usually will scrub up, you know, and take the baby as soon as the baby delivered, and I'll bring baby over to the resuscitate here. And sometimes we have a pediatrician present at the delivery. As soon as the baby is, you know, looking fine, we weigh baby and also attach the labels to the ankles of the baby, and basically make baby look nice. And then I'll take baby to the couple, and then they can enjoy having the baby.
You can have your antenatal care either at home with one of our midwives, at your GP surgery with your GP and your midwife, or we offer antenatal care in the hospital where you may be seen by one of our doctors and also by our midwives. During your visits with a health professional, you'll have your blood pressure measured and your urine checked. Most women stay in the postnatal ward between 6 hours and up to 24 hours. However, if you've had a caesarean section, you may need to stay in up to 3 days. When you get home, we'll organise the midwife to visit you and check how you and the baby are doing. Our staff can support you with breastfeeding and coping with family life with your new addition to the family. If you'd like to have your baby with us, let your midwife or your GP know, and they'll organise a referral letter for us. Alternatively, you can contact us directly and we'll make all the necessary arrangements. We look forward to seeing you soon.